Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 3 natural steps that you can take at home to relieve, prevent, or relieve your knee pain. But before I do that, I'm gonna go over a few studies for the current treatment, and we'll go over normal healing cycles so you will understand how to get to the root cause of your knee pain and address it properly before you waste money and time on non-effective treatments that study shows is not beneficial for your pain. This is very important study. It's a quantitative study. The researchers looked at several healthcare settings that performing total knee replacement. And what they said, they find that several different healthcare settings have identified that non-surgical treatment are underused. So basically, they don't recommend the non-invasive natural approach for patient, and actually total knee arthroplasty or total knee replacement is overused. That was actually the first thing they usually say: you need total knee replacement. You have bone and bone. And I have another video, the link in the bottom here, the common side effect for total knee replacement and why bone and bone is actually an accurate way of diagnosing and treatment for recommendation for total knee replacement based on studies. So when we look at the symptoms of the knee, when someone is recommended to you, you have to have a total knee replacement, usually based on bone and bone. That's a common misperception based on the studies. And you look here, this is a normal knee joint. It should look like nice and smooth here. When you start to have bone on bone or more bone spurs, you will start to see here a degeneration and a change in the texture of your bone. The symptoms usually inflammation, swelling, instability in the muscle in the joint, and excessive scar tissue internally in the joint. And when you have the total knee replacement, this is what's look like, and that is a common side effects for complication of the surgery. So the question is what you should do naturally to treat bone on bone, which is misconception for recommendation for total knee based on the studies. We need to look at the normal healing cycle. We need to understand how our body heal to really get to the root cause of the problem and treat it effectively naturally. So I'm gonna use external paper cut for visualization, but the same process happens internally inside your knee. So the first stage of healing is called inflammation. As you can see in the first image here, with inflammation, you start to have redness, blood rush to that area, and swelling. And that's exactly what happened internally in your knee. When you have internal inflammation, you start to have swelling in the joint. You start to have degeneration in the joint too. The second stage of healing is called proliferation stage. And as you can see here in the second image, the proliferation stage, that's when your body starts to scar, to build the scar tissue. And during this stage, if your body does not build the scarring, your open wound, your cut here, will never heal. We need a scarring. It's part of healing. It's a normal part of healing cycle. The problem is when you have excessive scarring, which the technical term for it is fibrosis, fibrotic tissue. And actually, when you look at your knee here, that is calcification or bone spur. That's actually fibrotic changes in the tissue, that excessive growth of scarring in the joint. That is a common issue for knee pain or knee injury. So during the stage of the proliferation, your body starts to have cascade of events: fascia restriction, muscle spasm, trigger points, and I will go over the fascia restrictions in a few slides. So perfect scenario during the maturation stage, in the last stage here, your body has to get rid of the inflammation and proliferation and clear up everything. That's perfect scenario. When you have chronic knee issue, there's very high chance your body going back and forth between inflammation stage and proliferation stage. So in order to treat the root cause of knee pain, we had to break this vicious cycle. So I'm gonna go over some of the treatment that's not effective based on the studies, and we're gonna relate that to the normal healing cycle. So it will make sense why you should not waste your money and energy on something that doesn't work. So the common things that used for treating knee pain, heat and ice and stim. And when we look at the healing cycle, that's not going to break your scar tissue, release fascia restriction, or do anything that will help to correct that dysfunction here. The other thing that's commonly used is massage. Massage could cause more inflammation. Foam roller, joint mobilization, which means moving your joint or joint adjustment, dry needling, stretching. And when we look at, this is a literature review that they reviewed over 16,000 study, and they came up with the conclusion, and they found that 8 systematic reviews, 8 studies confirming that stretching and exercise is not effective to relieve pain. Spinal manipulation or joint mobilization, acupuncture, trigger point injection, so on this list. These treatment has not proven to be providing a long-term pain relief based on the studies. So what should you do at home to really get through to the root cause of the problem? We have to really break this vicious cycle. So the first thing that you have to do is decrease the inflammation. We have to break this vicious cycle simultaneously from both ends, the inflammation and the proliferation stage. So what should you do for inflammation? If it's a minor inflammation, rest can help. But if you have chronic knee pain for a long time, rest is not going to be enough to relieve or decrease your inflammation. So what I personally use is Magna Heal 2. This is very strong magnet. The range of the magnet is about 3 inches, that actually when you wear it, that get in the joint to decrease internal inflammation. It's very important as part of the 3 steps is you don't pick and choose which step to use, because the success of the treatment depending on those 3 steps, the combination of those 3 steps. Because when we look at the healing cycle here, you have inflammation, you have scarring, you have fascia restriction. This issue has to be addressed simultaneously for best outcome. So what I usually do is have the patient wear the Magna Heal 2 while they're walking or sleeping, and their need to decrease internal localized inflammation. And also I like to put them on anti-inflammatory diet, because there's certain food that based on a study shows that it causes internal inflammation for several hours after eating. So we want to make sure we're not causing inflammation with the food intake. The other thing is for severe inflammation, if you have severe inflammation, that your pain level from 0 to 10, if your pain is 7 to 10 out of 10, that's indicative of severe internal inflammation, and naturally we want to have some supplements to decrease the inflammation in the body and also cause tissue repair. So I have a combination of supplements to help decrease the swelling internally in the joint and also promote repair of the tissue. And that's usually for severe condition that has severe damage in the joint or in the knee. So the second step that we have to work on simultaneously is the scar tissue. So when you look at this image, the first image here for the muscle that's look like nice and smooth. When you have a micro tear or damage in the muscle, you start to have a scar, tear like this. It's very random. When your body builds a scar tissue, it builds it very randomly like this. The problem is when you have excessive scar tissue, that could actually cause pain. And when you have that excessive scarring or calcification, that will cause a bone spur, as you see here, and that could cause knee pain or symptoms. So we have to actually decrease the swelling and also break the adhesion or that fibrotic tissue, so it will relieve the pressure on your knee. So what I personally do is I use the A3. This is to use superficially to break the superficial scar tissue, work on your quad, your hamstring, your calf, your knee joint to break superficial scar tissue. And I also use A5 to go very deep to break deep scar tissue. So the last step, you have to do it simultaneously, is address the fascia system. And this is extremely very overlooked by a lot of healthcare providers because there's not a lot of proper training on how to address it properly. An extremely important part of addressing knee pain. So when you look at the fascia system, the first image here, you can see the white filament. That's the fascia tissue. Those white filament are the fascia. And next time when you go buy meat, look at the white filament. That's the fascia system. So the fascia system, we have the superficial fascia layer that wrap the entire body, and we have deep layer wrapping a group of muscle, individual muscle fiber, and individual fiber. This is very complex system. So when you have fascia restrictions, it's like you're wearing a t-shirt 2 to 3 size small. So to make things complicated, but don't worry, the treatment very simple. We have two major categories for the fascia system: superficial fascia layers and deep fascia layer. The deep fascia layer divided to 4 subcategories of fascia. The apparatic fascia, which actually wrap a group of muscle, and then you have the epimysin wrapping each individual muscle fiber, and the premiysin wrapping a group of bundle of muscle fibers, and then the endomysin wrapping each individual muscle fiber. Why I'm explaining this? Because it's a very complex system, and there's not efficient technique to address all those layers. So what I personally do is we have to release all these layers simultaneously, because when you have a scarring, it kind of like glue all these layers together and preventing it from having elasticity, so you will move freely. So what I personally do is I use the A1 to release superficial and apparatic fascia, and I also use the A5 to go deep, release the epimysin, premiysin, and endomysin. We have to release not just the joint itself, we have to release the muscle around it, on the top, on the bottom, because a lot of the time when you have arthritic changes, a lot of these muscles start to get tight and get stiff and imbalanced, and you start having micro tear in the muscle from compensating from joint pain. So to get to the root cause of the problem is, first, you have to decrease the inflammation. At the same time, work on breaking the scar tissue and the fascia restrictions. And I will leave a link below for the instrument that you can use at home to really get to the root cause of knee pain. If you have any question, leave it in the comment section below, and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.